Hello everybody and welcome to another Women's Health Wednesday Live. I'm so happy to have you here. I am Jacqueline, women's health, menopause educator and coach, yoga for women's health, hormonal health specialist and passionate women's health advocate. And today we are going to be talking about inflammation. You may have heard about inflammation. You may have seen it in the news, in the media, talking about inflammation, but maybe you don't know what it is. Maybe a doctor has said to you, maybe you have inflammation. Maybe inflammation, the word is being used, but today we are going to get absolute clarity on what inflammation is, why you should care, and what happens in your body if your body is inflamed. So let's start with the basics. What is inflammation? Inflammation happens in the body. Let's talk about the regular inflammation that we are aware of. You hurt yourself, you cut yourself, you have an infection. Something is acute, short-term experience in the body, and your body wants to heal and repair. Our bodies are always looking to heal and repair and bring us back into balance. So you cut yourself, you've hurt yourself, you have an infection, something happens, and the body sends out or activates the immune response. Sends out cells, inflammatory cells and cytokine cells, and it sends all these cells, and often if let's say you've cut yourself, the area will be red, it may be hot, and that is the body's natural response to healing, to repair and healing, and that's what we want. However, there is another type of inflammatory response, and this is becoming more and more common, and that is chronic inflammation. And when there is chronic inflammation in the body obviously wants to respond to heal and repair. But it's not like a cut where it is an acute, location-specific, a momentary cause of inflammation. This is chronic, and it can be all over the body. And we're going to talk about what the potential sources of chronic inflammation are. But the body, for some reason, has been triggered into a chronic inflammatory response, and it is happening the whole time. The body, even though the body is trying to attempt a heal and repair response, the chronic triggers are always happening, and we are now in chronic inflammation. Chronic inflammation can be expressed in the body. How do you know if you're in chronic inflammation? It could be expressed in the body by the following symptoms: arthritis, joint pain, that feeling that your body is inflamed, stomach and digestive issues, thyroid issues, poor brain function, brain fog, feeling exhausted. All of these are potential signs of chronic inflammation. And if you are experiencing autoimmune disease or an autoimmune response like lupus, fibromyalgia, any type of irregular period or infertility, any of these could be a thyroid, a dysfunctional thyroid. Any of these could be signs of chronic inflammation and that your body is in constant autoimmune response. Okay, so what do we do about it? The first thing is obviously to identify the triggers. We always want to go, before we just treat the symptoms, we always want to go back and ask why. Why is my body in chronic inflammation? Why is my body constantly churning out an autoimmune response to an inflammatory trigger? So why, or where is the source of this inflammation? And it can be a number of reasons. What you're eating, inflammatory food, if you're eating a constant diet of high sugar, high carbs, high processed foods, a lot of bad quality fat sources, any of those sort of poor dietary requirements, or not enough of the good stuff. It's not only just eating the bad stuff, because bad stuff is maybe okay if you're balancing it out with good stuff, but if you're eating the bad stuff and you're not balancing it out with anti-inflammatory foods, then just purely what you're eating can be inflammatory trigger for your body. The other thing that could be inflammatory is stress. Chronic stress is super inflammatory for the body. And other things such as poor lifestyle, excessive alcohol use. I'm just having a look at my list. Sometimes doing too much exercise. If we are obsessed with exercise, if we are over-exercising, and over-exercising will look different for all different people, but over-exercising can also create a stress and inflammatory response in your body. So whilst acute inflammation is good, and we want the acute inflammation, we want that natural, normal body response to inflammation, chronic inflammation and the consistency of inflammation cells churning out in the body, cytokines churning out in the body never having that time to just calm and come down from an inflammatory response is potentially problematic. And as I said, there are clear symptoms of that consistent inflammatory response. And if you already know that you have lupus, thyroid dysfunction, Hashimoto's, or Graves' disease, if you have fibromyalgia, if you have irritable bowel syndrome or any other type of digestive system, if you have chronic fatigue, if you have chronic brain fog, any of these consistent triggers that you are going through, it can be other things. Absolutely. It is not only and exclusively an inflammatory response. It can be other things. We need to sit and go through and do blood work and figure out what's going on in your body. But it is absolutely possible that it is an inflammatory response. So diet, what you eat, movement and exercise, getting the right type of exercise, regulating the nervous system, nourishing ourselves potentially with supplements or other things. We want omega-6 is excellent for an anti-inflammatory. Turmeric, curcum, cinnamon, excellent for anti-inflammatory. Cutting out the inflammatory triggers, the inflammatory foods very often. Nourishing ourselves and understanding that chronic inflammation is itself a trigger for chronic disease. Heart disease, brain function, rheumatoid arthritis, ache, joint pain, long-term digestive issues, any of the chronic diseases that we are familiar with often can be looked back from triggered by chronic inflammation. And then we have to go back even further and ask, why do I have chronic inflammation? Chronic inflammation can be reversible. We need to sit down and go through the protocols. We need to understand where you are on your health journey and understand your personalized story and look at what protocols are appropriate for you in your personal situation. And then decide what is the best route for you. Very often when you go to your doctor, chronic inflammation, autoimmunity, they will say one of two things. The first thing is, there's nothing I can do to help you. You've just got to find the management. Or secondly, take medication. But as we know, and as I've said time and time again, if you're not looking at the root causes of your chronic disease, if you're not looking at the root causes of your chronic inflammation, if you're not looking at your lifestyle, your stress, what you eat, how you sleep, how you practice self-care, if you're not looking at those key essential things, you can take as much medication as you want. It's not going to help. And living with it is not an option. I don't want you to think that living with it is a strategy, because it's not, because you do not need to be in pain. There are things you can do. So I hope that's created a little bit of clarity around inflammation, a bit of a distinction between chronic inflammation and acute inflammation, and understand that the inflammatory response is our body's natural way to repair and heal. But when it goes on for too long, when it goes past that natural normal response and we're in chronic phase, that is not where we want to be living. The implications of that and what we can do about that. If you have any questions, please reach out to me. Let me know how I can help you. We can schedule a consultation to go through your specific symptoms and start to get to the underlying causes of why you're going through what you're going through. Have a fantastic day, and I look forward to seeing you next week at Women's Health Wednesday Live.